Hey guys, welcome back to my YouTube channel. Today I'm coming a little bit more relaxed with my style of dress. Normally I'm like so professional and wearing a blazer, but honestly this is the reality of working from home. You don't get dressed professionally every single day. Today I am continuing the public health series. Somebody left a comment down and asked me to discuss the difference between a master's in public health and a master's in science in bioinformatics. So that's what I'm going to get in today. Make sure you subscribe if you aren't already subscribed, and if you are, make sure you like, share, and comment on this video. Let's get started. I talk so much about what you can do with your master's in public health. I do appreciate that people are leaving comments and telling me what they really want to know and the differences that can better help them make wise career decisions. So first off, I'm going to start by explaining why you should get your master's in public health. I would say get your master's in public health if you're interested in serving a community. I'm going to stop right there because some people might think working in regulatory affairs or working with big pharma, how are you serving a community? I opted to only work within the hematology oncology space because I've had a passion for sickle cell diseases. I've talked about so much on this channel because I am a carrier of sickle cell trait, working to make sure drugs are getting approved, looking at research, working on the drug development process essentially within that community. As a person with a master's in public health, that's the community that I've chosen to serve, as well as the Black and Brown community. Get your master's in public health if you're focused on the health of a community. An MPH is all about prevention, as I always say. Doctors treat, public health professionals prevent diseases from actually happening. If you're interested in getting involved in government health or nonprofit health, Master's in Public Health is also something that you should do. Now, with a Master's of Science in Bioinformatics, I'm not even gonna lie. Having your master's in science in bioinformatics is a hot commodity, but again, it depends on what you want to do. I'm very happy that I got my MPH, and I think an MS in bioinformatics is very interesting, but I'm not all that interested in the biotech side of things. So I would say if you're interested in more in the tech side of medicine, then you should definitely get your master's of science in bioinformatics, especially with the way the world's moving. Everything's more quicker, faster, better, more tech, just more technology in the healthcare space in general. I think I saw the other day that basketball players can wear this ring and it tests them for coronavirus within like seconds. That is essentially what someone with a master's in bioinformatics would be a part of. A lot of companies are paying top dollar for people who have their master's of science in bioinformatics because essentially you're taking data and translating it into information that is useful to treat a population. Bioinformatics is essentially a merge of medicine, science, computer science, and healthcare. Like I said, you're taking raw data and turning it into information. I would say a person with a master's in bioinformatics is probably a little bit more behind the scenes because you're dealing with the raw data. You have the raw data. Someone with a master's in bioinformatics would basically be dealing with that raw data and translating that into information that now a person with a master's in public health can take and disseminate with it whatever they need to do. Both degrees are really great, but as we move forward towards more technology, an MS in bioinformatics will definitely be insanely useful. I feel like people with their master's in public health now, before when people were getting it, it wasn't, people didn't really understand what public health was or what they could do with it. But as people are starting to learn more about what an MPH is or what a bachelor's in public health is, more people are interested in that. Whereas an MS in bioinformatics is a new hot commodity. Get that MS in bioinformatics if that's what you're really interested in. Or you can get off for the MPH. It'll still always be useful, but again, hot commodity versus eventually people will understand public health and it'll become saturated like most things do. Whereas that other degree is just up and coming. Well, I hope that answers your questions about the difference between an MS in bioinformatics and an MPH. Make sure you guys leave comments down below and let me know if there's anything else you want me to add to this public health series. Again, thank you so much for your support and always watching, guys. Bye.